Hello and welcome to the program Healthy Living on Trust Television. I'm Aisha Salihu. In a previous episode of the program, we looked at the prevalence of chronic kidney disease in Nigeria and the way forward. So we're picking the conversation right from where we left off with kidney transplant and donations, which is most likely the last resort for patients suffering from chronic kidney disease. According to reports, Nigeria has good kidney transplant hospitals owned by the federal government. They include University College Hospital situated in Ibadan, Aminu Kano Teaching Hospital in Kano, Federal Medical Center Umuahia in Abia State, University of Nigeria Teaching Hospital in Nugu, among others. Reports also have it that the progress done so far is a living donation for kidney transplantation in many centers in Nigeria, where a person who is undergoing dialysis brings a donor. It has become pertinent that organ harvesting and transplant tourism is a viable business where people engage in it illegitimately and indiscriminately. I have joining me virtually on the program today Dr. Obi Ekwena, who is a transplant surgeon and a professor of transplantation and urology, University of Toledo, Ohio, United States of America. Welcome to the program, Dr. Obi, and thanks for joining us.
Thank you, Aisha. I appreciate the opportunity to be here to speak with you guys.
So let us begin our conversation. We have seen indiscriminate cases of organ donation and harvesting. What would you say are the ethical guidelines for organ donation and harvesting?
Well, first of all, as you rightfully mentioned, when patients have kidney failure, the choices left for them are one, to be on dialysis, which is sort of a technique used to filter the blood, do the job of the kidney. The other option is to have a kidney transplant, and kidney transplant is sort of the gold standard or the best treatment for patients who have kidney failure. All over the world, this is sort of the standard of care for patients. In the United States, where I practice, and also in Nigeria, there is, the option of dialysis for some patients. There's, transplantation is offered in a lot of centers, as you mentioned, in Nigeria. Deceased donor transplantation, where someone passes away and the organs are persons who volunteered to donate their organs when they pass, can offer their organs for patients who have end organ failure. And so, living donation involves when, there's a willing donor, as you mentioned, who gives their organ of their free will to someone who needs an organ, or, in this case, we're talking about kidney transplantation. One thing that you mentioned, which is harvesting, is a term that we typically in the transplant community do not use. We talk about organ procurement or donation. So harvesting, as you kind of alluded to, has to do with unethical, sort of illegal activity surrounding organ transplantation. And so as far as the ethics of transplant, first of all, an organ, a human organ, is not a commodity, right? So that's the first definition. We do not commodify human parts, and so once that is, I think it's almost repugnant. It just doesn't sound right. It doesn't feel right when we talk about commercialization of human parts. And so in that sense, when we, from an ethical standpoint, understanding that an organ, a human organ, is not a commodity. That's number one. That is the first definition, right? And then, and the terms that are used to around an organ, for example, we cannot use the term harvesting because again, is not is not it's not a coconut or a plant that you can just go and pluck out of the tree or in your farm. So our human body is sacred. I think most people will agree to that. And then the ethics that surround that definition sort of guide us in how we approach organ transplantation or even donation. I'll stop there and then kind of follow up.
So I use that term harvesting deliberately because I know you're a professional, and then you'll guide us around the ethics surrounding the regulations
Sure.
and how
Sure.
this practice is carried out. Now, still in line with the regulations, I understand that you did mention the deceased, and I'd like to know, let us explore what are the regulations for the deceased, because I know that some people say before the pass, they may choose to have some parts of the body donated to people who are in need of this. So let us explore regulations for the disease and also living organ donations too.
Sure. In Nigeria specifically, we know that the law, the Organ Transplantation Act, I want to say it was in maybe early 2000s that law was passed. I can't remember exactly the date now, but that law does have provision for deceased donation. So meaning, someone, wants to donate their organ, they can, that could be done. There's a process through which that is done. What I would say, that the act and the Nigerian law probably needs to be refined a little bit to be more specific on how that can be done. Obviously, till date, there's not been any recorded deceased donor transplant that has happened in Nigeria. I know that there are efforts to make that happen, and we could talk about that a little bit. But in the United States, at least at my center where I work, so for example, I've designated on my license that if something was to happen to me and I can function, whether my brain is dead or my heart stops, that I offer my organs for donation. So what would happen is, at least in the United States, if in the case that there's no medical intervention that can revive myself, or I'm just using myself as an example here, then my organs can be procured and they can be donated to someone who needs it. And so that is sort of one aspect of it. So you designate that you want to be an organ donor, and that could be identified in some registry, whether it's your license or through some registered form. The other option in some parts of Europe is that where every person who's of age is identified as an organ donor. So if something happens to them, then they are they've opted in, right? But you can opt out by signing something to say, hey, look, I don't want to be a donor, and that would be respected as well. So in the case of Nigeria, and I think the details of deceased donation is still being worked out in certain places. I mean, in certain states, I know that the Lagos state is working on something where they, trying to work out the details of that, how that can happen. But the law, the Nigerian Organ Transplantation Act, has framed it, has sort of laid out a pathway to sort of make this happen. There are a lot of challenges. I mean, we could talk about all the challenges that surround deceased donation, whether it's cultural, whether it's belief systems, religious. There's so many things that huddles I'll just say huddles that need to be overcome before we get to that point in Nigeria, for sure. All that requires education and awareness creation so that can happen in a safe way, right?
Mm.
Then when we talk about living donation, which is already happening in Nigeria, the first transplant in Nigeria happened in 2000 at St. Nicholas Hospital under an arrangement by Dr. I think it was Shinobare and Dr. Bamboye. So they started transplantation or brought expertise from outside, and they helped start transplant in 2000. And that first transplant was a living donation. I think it was a pediatric case. And so since 2000 till now, there's been quite a bit of transplants in Nigeria. There's a couple of centers that are high volume centers, I would say, in Abuja. And so living donation has been going on in Nigeria for quite a bit of time. And then there are framework, laws, ethics that guide that as well. And I know we're going to get into that a little bit more.
Mm. So still in line with living donations, we have been talking about that. Could you walk us through life expectancy of the patient as a precondition for transplant?
Sure. So, as you rightfully mentioned, a living donor, when I take my Hippocratic oath says, I should do no harm. But when we, offer the opportunity for a person to donate their kidney, we aren't going to do harm to somebody who does not need surgery, So with that, we have to make sure that that person who has come forward out of their free will, that we examine them thoroughly, that when we are procuring this organ from them, that they will do as well as they should, even with both kidneys, right? Mm-hmm. So we do a thorough exam. So the donor comes forward, and what I tell the living donors when they come to me is that I'm looking for a reason for you not to donate, meaning that I'm trying to figure out if there's a reason that should preclude that person from donating an organ. If they go through the workup as they should, right? They get through all the examinations that we put them through, then their risk of donation is minimal. I can go ahead and counsel them that, hey, you can donate safely. And so living donation is safe. Okay, that's the paramount thing. Living donation, donating a kidney is a safe thing to do. But that has to be done. I can only say that living donation is safe when the process has been completed in a thorough manner, where exams have been done, or laboratory testing have been done, counseling has been done, and everyone is well aware of all the things that will make sure that person after donation will live a normal life after donation. And so there's evidence, clinical evidence to show that, living donors, even after donation, live, probably slightly, even at some points, they live, their life expectancy is maybe even slightly better than those that of the general public, because these are the healthiest of the healthy of our population.
I've seen people who have had stories about conditions coming up. As much as it's safe to do that, conditions. I'm asking this question because I'd like for us to know what kind of, what kind of preconditions dictate a reduced number of years to live, and what is advisable.
Right. Yeah. So, there are people that are born with one kidney and they can live a normal life, right? So, the first person to donate their kidney successfully was in 1954. Okay. And that person, that was in the United States, that was a twin. He donated to his brother and he lived a normal life till about 2010 or so. And he died of, natural causes. So, my point is, there's solid evidence to show that people can live a normal life expectancy after donation. There are things that can preclude people from donating their kidney, though. I think that's what you're asking me. What are the things that we will say no to? Well, if somebody has a history of diabetes can lead to kidney failure. So if someone has kidney diabetes, we'll say no to them outright. So therefore, we make sure we test them. We test all individuals who come forward to identify if they have diabetes or even if they have pre-diabetes, right? So we can identify that. And if we identify that, that person can now donate because they are at risk of developing kidney disease, heart disease, and so forth. If somebody has a history of high blood pressure, right, we also potentially can say no to that person, right? Because high blood pressure can lead to kidney disease, can lead to heart disease, and so forth, right? If somebody has a history of certain cancers, we may say no to them, right? If some people have, you know, a history of, genetic predisposition to kidney disease, we may say no to them. So there are different conditions that can preclude somebody from donating. Someone who's younger than 18 years old, we say no to them, right? Somebody who is not counseled appropriately, who does not know what donation is, we say no to them, right? Someone who has no way of following up, right? If they cannot even, after they donate their kidney, we cannot see them afterwards. We have a social worker evaluate them and make sure that if they can't, there's certain parameters, like I should say, that not only health related, but also social circumstances. If there's an evidence of coercion, whether it's, financial, social, whatever it is, that person may not donate. So there are multiple aspects or multiple parameters and multiple criteria that we look at to make sure that that living donor, after they donate their kidney, will have an excellent outcome. Not good, not very good. That living donor has to do fantastic, has to do well after they donate their kidney.
Thank you so much for your contribution, Dr. B. We'll go on a quick break now, and when we do return, we'll pick up this conversation with Dr. B. Don't go away. We'll be right back. Welcome back. If you're just joining in, this is the program Healthy Living on Trust Television, and we have our guest on standby, Dr. B. Ekwena, who is a transplant surgeon and a professor, transplantation and urology, University of Toledo, Ohio, United States of America. We still have you on the program, and then earlier we were talking about our preconditions where you would not advise a particular patient to donate their organs. But then let us look at what then would you say are the key determinants of a successful transplant outcome?
Well, the beauty of transplantation, unlike any other part of medicine, is that, you have a patient who is on death's door for the most part, right? And you have this beautiful gift from somebody who has come forward. I call them a lifesaver, who gives this beautiful gift, this miraculous thing. And we are able to put this organ into someone, a recipient, who is on death's door, and you immediately are able to see life restored in that individual. I mean, it gives me chills talking about it, and it's a remarkable event. And so I'll give you a straight example. So when I take a kidney or procure a kidney from a living donor and transplant it into a recipient who has been on dialysis for a while, what you see within hours of the completion of the procedure, it's maybe somebody who's not been making urine, and all of a sudden they start making urine, and you see their color change. They tell you that the food that they eat tastes a little bit better. They're able to move around. They're off a machine. So in terms of outcome, there's short-term outcomes, which is off dialysis, able now to make their own blood, able to filter their blood on their own. Um, you know, and then they leave the hospital and ultimately get back into their lives. They're able to travel, they're able to live their lives, they're able to have children, they're able to, sort of live like you and I would do, or someone who has not been on dialysis. So that's one aspect of it. So that's kidney. For someone who has a liver failure, for example, that is even more extraordinary because someone who has liver failure is basically, without a liver, they're dead, right? And if you put a liver in that person's can walk out of the hospital from a coma, for example. You talk about a heart transplant, or you talk about an intestinal transplant. So transplantation is transformative. It's really miraculous. We talk about miracles, and for us in transplant, transplantation is the closest thing to a tangible miracle in that sense, I would say. So
it looks like you've
yeah,
answered
so
my next question, but then I'm still going to ask the question. I wanted to ask, what are the health implications for the donor or the recipient of this particular organ after the surgery?
Yeah, so the donor, in the United States, when someone gives their kidney, or I'll just use a kidney as an example here. So when you give a kidney, we follow you for at least 2.5 years, closely monitoring your blood pressure, monitoring your labs. And for the patients that I transplant in Nigeria, donors that I'm involved in their care, we do the same thing. We make sure, even through one of the organizations that I work with, called Claire and Call, we follow these patients for 5 years, and that's sort of our mandate right now, is to make sure that the donors have post care, right? Not because they're going to suffer any major consequences, but we just want to make sure that their blood pressure is okay and their laboratory values are fine, and so there's close follow up there. For the recipient, they're on lifelong medications so that they don't reject the kidney, and so when we have these medications that the recipients are taking, we have to monitor the person lifelong. So, once the kidney is transplanted, doesn't mean that now they can just, go out there and not have post-transplant care.
Speaking of maintenance care and routine follow-ups, how consistent should that be after surgery?
For the recipient, initially, sometimes we see them once or twice a week in the first month. And then, after, as things get, as things stabilize for the recipient, we see them once a month, and then we see them once every 3 months, and then once every 6 months, and so forth. But the idea is that we do see them. We have to see them very, very closely. And the donor, as I said, for our routine is to see them, 6 days after surgery, once they leave the hospital, and then 6 weeks later, 3 months later, 6 months later, and then, subsequently after that, we see them very, very closely, and
Finally,
applies
I'd
for
like to ask a last
recipients and
question.
donors.
Earlier you did talk about unethical practice leading to harvest, and however it should be organ procurement. And it seems to be the order of the day. It's become a thriving business, although it's against the law. Let's explore the legality of the donation process. I mean, it has to involve getting a court affidavit, that showing that there is no financial inducement involved, among other investigations, right?
There is a high demand, or there is a high demand for, organs, period, all over the world, even here in the United States, everywhere, because the demand for organs and the availability of organs and its demand. There's a lot more people with organ failure than we have organs to give. So there's a black market. Excuse me. And so there are various ways that governments or institutions are able to sort of put guardrails around organ donation, so we can reduce the black market. In 2008, the transplant professionals gathered in Istanbul, and they put together something called an Istanbul Declaration, and where they kind of stated, some put together guidelines around organ donation. And so that Istanbul Proclamation sort of helps put guardrails around transplantation. And then, governments have been encouraged to enact laws that protect donors, from poor people from exploitation, especially, and not only, I think it's just people can be vulnerable to exploitation. And when you have, poverty is one way, one big component that can predispose people to exploitation. And so, we can cure, we continue to encourage, governments, and not myself, but, the world bodies, encourage governments to tackle poverty, because, when you can tackle poverty, you can, sort of decrease the number of people that can be exploited. And so not only that, now we encourage institutions to have the mechanism to evaluate donors, right? And educate them on what their rights are, and what is informed consent, right? So, making sure that informed consent is followed, and so that you can reduce the black market.
Okay.
I don't think we can necessarily eliminate it because of the disparity that exists, but we can definitely do more about educating folks. There's an organization that I've been working with, really, that one of the ways that we think we can tackle the black market is to educate people.
Okay.
Right? So if we can educate people about, look, this is what donation is about. You're not selling your organ. You can give out of your own free will, making sure that donors have adequate follow-up afterwards. Making sure that people understand what informed consent is. Informed consent. I mean, that's paramount.
All right.
And then and go from there.
Okay, thank you so much, Dr. Obi Ekwena, a transplant surgeon and professor of transplantation and urology, University of Toledo, Ohio, United States of America. Thanks for making out the time to join us on the program.
Thank you, Aisha. I appreciate the opportunity.
Okay. That concludes our conversation on this episode of the program, as we explored the incredible world of kidney transplants and donations. Remember, by donating organs legitimately, we can give the gift of life and transform the lives of those in need. For comments, contributions, and suggestions on this episode, subscribe and follow us across all our social media platforms. Join us next time as we continue to unravel the marvels of modern medicine. Stay healthy, everyone. I'm Aisha Salihu. Thanks for watching.